Okay, so we've already grabbed all of our resources and materials.
We've done hand hygiene already.
Mm-hmm.
The bed is locked and the rails are up. And since we are starting to do care, we can raise the bed level for proper body mechanics.
Alright, my name is Nurse Sammy.
And Nurse Jules, we're going to be giving you a bath and changing your linens today.
Can you tell us your name and date of birth, please? Joe King, March 8, 1929. Perfect. Okay, Joe. We're going to remove the call light, the bed alarm while we do the bath.
Do you have to use the bathroom before we do the bath? Okay, that sounds good. I'm going to pull back the curtain.
I'm going to give him some privacy when we get started.
Sammy, I'm going to step away and get some water.
Alright, let's have you use the restroom.
Back in, I'll do some hand hygiene.
Alright, you let me know when you're done, okay? We will use this comforter later. We're conserving resources.
Check the water with my wrist, make sure it's not too hot.
You done using the restroom? Okay, perfect. You grab it with the handle, keeping it flat. I'm going to go step away to go wash this in the restroom.
Alright, Joe, I'm going to remove your sheet.
Coming back in, doing hand hygiene.
You grab the bath bucket.
Yes.
Start unsnapping our gown. We'll have the bath sheet to give Joe some more privacy and to keep him warm.
We want to make sure we still have proper communication with him.
And with our other nurses. That's why we let each other know when we're going to leave the room.
Removing linens. Doing great, Joe.
Alright, Joe, now we're going to wash the face without any soap first. We're going to use different sides of the washcloth to do different pieces of the face. We're going to start from the inside of the eye to the outside.
We're going to make sure if he has an IV or anything or oxygen tubing that it's not underneath him. And at this time we're going to assess the oxygen tubing. Cleaning it, making sure there's no skin breakdown anywhere around it on the nose or ears.
Joe. Now we will put some soap in the water. And we will start cleaning the extremities and the chest.
We want to go distal to proximal as we do the extremities in order to promote circulation.
The whole time we're still checking to see if there's any skin breakdown or bed sores, pressure sores. Going between the fingers. How you doing? You warm enough? Almost done.
Do the chest, if they were a female or if the male had breasts, and if anyone has folds in their skin, we want to make sure we really clean those. After cleaning everything from the padding dry.
We want pat dry so that there's not any friction or shearing going on.
Joe, would you like any deodorant today? No? Okay.
Cover you up while I go down to your legs.
You're going to feel so clean, Joe.
Again, we're going distal to proximal. Assessing for any skin breakdown or pressure sores.
Checking between the toes, making sure there's no fungus or on the heels.
Pat dry again, just like the upper extremities.
Alright, and at this point, I will be doing care in the front, so I need to go do hand hygiene. Putting putting gloves on at this point. Okay, so starting at the tip, you would move down. If they're uncircumcised, you would need to pull that down and clean. If they're a female, you would have to use the onion method to make sure you're getting everything front to back. Doing good, Joe.
Alright. Before we do the back, I'm going to go get a change of water. I'm going to step away. I'm going back into the room and do some hand hygiene and put on some gloves.
Jules, I'm going to step away quick to remove my gloves. Also do some new hand hygiene.
Okay. Alright, Mr. King, we're going to roll you, okay? Ready?
3, 2, 1.
Making sure the head is not in the rails. We're going to start up with the back, going out, up, and outwards. Alright. Now doing clean to dirty. If I were doing a female, I would clean her the same way.
Doing good, Joe.
Using different layers of the washcloth. Alright. Get some different gloves on. Do some hand hygiene.
Alright, Joe, I'm going to rotate you back. Ready? 3, 2, 1.
Would you like a back massage? Are you looking? Okay. If we were to do a back massage, we probably would do about for 2 minutes for a pain relief. Alright, let's throw these linens away and put on a new gown. Some nice fresh clothes always feel good, don't they?
Alright, Joe.
Want to make sure that there's an IV, we don't accidentally pull it out or disrupt any of the tubing.
Still ensuring privacy.
Have the typos.
We're going to put these on to help circulation and prevent clots. Alright, Joe, bear with us here.
Almost done. We put these on to encourage circulation and prevent clots.
There's holes in the toe portion to assess. You can take pulse, you can do calf reflex.
When we do this, we want to make sure that there are no wrinkles.
Wrinkles could cause pressure sores. Doing good, Joe.
Thank you for being so patient with us.
Doing good, Joe. Perfect. How you doing? Oh, you would like some deodorant now? Okay, let's grab you some. Here you go, Joe. That'll make you feel a little bit better, huh? Get your sheets changed just a little bit. Doing good. We're almost done, okay? You're so hard to put on.
Alright, there we go, Joe. Sorry about that.
Alright, Joe, we're gonna start changing your linens, okay? So I'm gonna rotate you towards me. Ready? 3, 2, 1. Making sure his head's not in the bed rail. Keeping him nice and comfortable as much as we can. Ooh, great, Joe.
So we don't want to get any bed sores, pressure sores.
Joe, we're gonna have you roll over a little bit of a lump, okay? Alright, you ready, Joe? 3, 2, 1. We're gonna rotate you towards Jules now, okay?
3, 2, 1. Here we go. Making sure the head still is not in the rails.
Rolling the linens, dirty linens into themselves again. Discarding the dirty linen.
Just checking to make sure tubing's not under him.
Alright, Joe.
Moving back over. Here we go.
Perfect. We'll get you a new pillow, okay? Making sure we're not shaking the pillowcases. Holding it away from our bodies.
Grabbing you. Flat sheet here. Nice and toasty. Let's pull you up a little bit. Your feet are hanging down.
We want to turn the pillowcase inside out.
Tuck in this area right here. Tuck in the corners, but leave enough room for the feet to be able to move.
That fitted sheet is not the most fitted, but that's okay for today, Joe. Alright. Making sure the tubing.
Now we'll put back the comforter on that we saved to conserve our resources.
Is that nice and warm, Joe? I know you're a little chilly.
Thank you for being so patient with us.
Making sure there's room once we tuck this in for his toes to breathe a little bit. We want to do hospital corners. Want your bed to look nice and pretty, right, Joe? Alright. Get you some dental care in a second too, Joe.
Sit your head up a little bit.
Alright. Jules, I'm gonna walk away to get our dental care stuff and do some hand hygiene.
Whenever Lamb can put it flat because he does have oxygen, and laying it flat would make it a little too hard for him to breathe. I'm going to step away now and do some hand hygiene before I do dental care.
Oh, you have dentures, Joe, too? Okay, we'll clean the teeth and dentures. How about that today?
Put on some new gloves.
That really makes sense, but that's okay.
Alright, as I'm brushing the teeth, I'm looking for any dental caries, but it's looking pretty good. And I'll have them spit.
You do the dentures in the sink and lay a washcloth down in case they were to fall or anything. Making sure they're nice and clean. Putting a little bit of water in the cup with them. Keep them moist, put into the patient's mouth a bit easier. Joe, I'm gonna put these on your bedside, okay?
You're going to put your call light near you. Do you remember how it works? You're going to clip it on near you and you just press it if you need anything. Sammy's putting on your bed alarm now.
Alright, here's your call light, Joe.
Now, since we're going to be leaving the room, we're going to put the bed down. And the side rails are up and the floor mats are in place in case of a fall.
Alright, Joe, do you need anything else from us today? No? Okay. You remember, you call us if you need us.
We'll start decluttering the room and do hand hygiene as we leave.